sir.
Dean, good morning.
And
Great conference so
you know
far.
what? We always have great conversations, but today's conversation, Sunshine Health has always been a huge supporter of FALA, and we always appreciate that. So this is all about the champions of innovation. So I know that you guys are always trying to figure something else to make, and whether it's not innovative or whatever it is, what can you tell us that sets you apart and why people love Sunshine Health?
Hey, well, thank you for asking those questions, and thank you for putting a great conference on, first of all. At Sunshine Health, we've been the leader in long-term care for the past 13 or 14 years here in Florida. There's a couple things that I can talk to around our innovation and why the providers like to do business with us. Recently the state of Florida moved to a risk adjustment model for revenue for all managed care plans in the long-term care business. This is an exciting way to be able to provide more upside income for the assisted living facility providers. Currently, the pricing model for assisted living facilities is basically one flat fee. It doesn't depend upon the member's level of care needs.
No.
It does not. But we have a 20-page assessment that we do, the 7-to-1B assessment, that drives the risk-adjusted revenue that we get as an MCO.
Oh, okay.
So based upon the level of care that the member needs, we could provide higher levels of reimbursement for the facility depending upon what the member's needs were. And on top of it, since your caregivers and your staff know the members better than we do, you see them every morning, every afternoon, every evening. We're only in front of them every 90 days. If you can help us fill in the holes on that assessment and really improve the quality of that documentation, that increased revenue opportunity can flow back to the providers. So that's a very exciting
And I know that
opportunity.
you guys are always looking for ways to engage your members within the community. I remember, some of the things you guys were doing were more steps, more, making sure you have your flu shots and all that. Is that also part of that?
So there's a second program that we're developing, and I'll talk more about this in the panel this afternoon. It's really an opportunity for a value-based payment model where we partner the assisted living facility with a primary care provider. And there's an upside gain sharing opportunity where we basically borrow from the future. So we're taking money that we would otherwise spend on emergency department visits and inpatient admissions, and if we can prevent those through, care gap closures and well visits and immunizations, as you said, that money can be paid up front to the assisted living facility instead of to the hospital down the road.
Okay. And so later on, he was talking about a panel. So we're going to, on FALA TV, we're going to have parts of that. And of course, Brad's going to be speaking to that. And value-based care, it's something that ALFs are just now trying to wrap their heads around, and that's why we really wanted to have a panel discussion. It's always so good to see you, and what I love is at our 15, and last night we announced we're having an ad, so we'll have 16 chapters. You guys are always so well represented, and it's just like, it's like a big, gorgeous family, and we love that so much.
Thank you very much, Dean.
Hey.
It's a pleasure to meet with you, and I appreciate you taking the time.
Thank you.
All right.